What is an anxiety disorder? An anxiety disorder is a mental health condition characterized by excessive and persistent feelings of anxiety and fears about everyday situations. These feelings can interfere with a person's ability to perform daily activities and can manifest in various physical symptoms such as increased heart rate and sweating. Some common types of anxiety disorders include generalized anxiety disorder, panic disorder, and social anxiety disorder. Treatment for anxiety disorders often includes therapy and medication. Who is at risk for anxiety disorders? Anyone can develop an anxiety disorder, however, some people may be at a greater risk than others. Risk factors for anxiety disorders include genetics. Anxiety disorders can run in families, so people with a family history of anxiety disorders may be more likely to develop one themselves. Trauma or abuse. Exposure to traumatic events or abuse can increase the risk of developing an anxiety disorder. Chronic medical conditions. People with chronic medical conditions may be at a greater risk for anxiety disorders. Substance abuse. Substance abuse can increase the risk of developing an anxiety disorder. Life events. Certain life events such as divorce, unemployment, or the death of a loved one can increase the risk of developing an anxiety disorder. It's important to remember that having a risk factor does not mean that a person will develop an anxiety disorder, and many people develop anxiety disorders without any known risk factors. What are the types of anxiety disorders? There are several different types of anxiety disorders, each with its own set of symptoms and characteristics. Some of the most common types of anxiety disorders include 1. Generalized anxiety disorder. GAD is characterized by excessive and unrealistic worry about everyday events and activities, often with physical symptoms such as muscle tension and fatigue. 2. Panic disorder, characterized by recurrent and unexpected panic attacks, which are sudden episodes of intense fear or discomfort that may include physical symptoms such as a racing heart, sweating, and shortness of breath. 3. Social anxiety disorder, SAD, characterized by excessive fear and anxiety related to social situations and interactions, often leading to avoidance of social situations. 4. Specific phobias, characterized by intense fear and avoidance of specific objects or situations, such as fear of heights or fear of flying. 5. Obsessive compulsive disorder, OCD, is characterized by persistent and uncontrollable thoughts, obsessions, and repetitive behaviors, compulsions, that the individual feels compelled to perform. 6. Post-traumatic stress disorder, PTSD, is characterized by re-experiencing traumatic events, avoidance, and increased arousal, usually after experiencing or witnessing a traumatic event. 7. Acute stress disorder, characterized by symptoms similar to PTSD but occurring in the first month after a traumatic event. 8. Separation anxiety disorder, characterized by excessive and developmentally inappropriate fear of separation from home or attachment figures, usually seen in children. It's important to note that some individuals may experience symptoms that do not meet the criteria for any specific disorder but still cause significant distress and impairment in daily life, which is then considered an anxiety disorder not otherwise specified, ANXNOS. What is generalized anxiety disorder, GAD? Generalized anxiety disorder, GAD, is a type of anxiety disorder characterized by excessive and unrealistic worry about everyday events and activities. People with GAD experience a high level of anxiety that is not focused on any specific object or situation and is often described as free-floating anxiety. The worry associated with GAD is often excessive, unrealistic, and difficult to control. Symptoms of GAD can include persistent worrying or obsessing about small or large concerns, difficulty controlling or reducing worry, difficulty relaxing or feeling rested, fatigue, difficulty concentrating, irritability, muscle tension or headaches, sleep disturbances, nausea or digestive problems. GAD can have a significant impact on a person's daily life, making it hard to carry out routine activities, maintain relationships, and perform at work or school. It is usually diagnosed by a mental health professional through a thorough evaluation, including a physical examination, a review of symptoms, and a psychological evaluation. Treatment for GAD typically involves a combination of therapy and medication. Cognitive behavioral therapy, CBT, is a commonly used therapy that can help individuals learn to identify and change negative thought patterns and behaviors that contribute to their anxiety. Medications such as antidepressants and anti-anxiety medications can also be used to help reduce symptoms of GAD. What is a panic disorder? A panic disorder is a type of anxiety disorder characterized by recurrent and unexpected panic attacks, which are sudden episodes of intense fear or discomfort. Panic attacks are typically accompanied by physical symptoms such as a racing heart, sweating, trembling, shortness of breath, chest pain, and a fear of losing control or dying. During a panic attack, a person may feel as though they are having a heart attack, or that they are going crazy. These feelings are often accompanied by intense physical symptoms such as a racing heart, sweating, trembling, shortness of breath, and chest pain. Panic attacks can occur unexpectedly and may be triggered by a variety of stimuli, such as certain situations, places, or memories. Some individuals may experience panic attacks in specific situations, such as when driving, flying, or in crowded places. This is called agoraphobia. Panic disorder is typically diagnosed by a mental health professional through a thorough evaluation, including a review of symptoms, physical examination, and psychological evaluation. Treatment for panic disorder typically involves a combination of therapy and medication. Cognitive behavioral therapy, CBT, is a commonly used therapy that can help individuals learn to identify and change negative thought patterns and behaviors that contribute to their panic attacks. Medications such as antidepressants and anti-anxiety medications can also be used to help reduce the frequency and intensity of panic attacks. What are phobias? A phobia is a type of anxiety disorder characterized by intense fear and avoidance of specific objects or situations. People with phobias have an irrational fear of something that poses little or no actual danger. Some common specific phobias include fear of heights, fear of flying, fear of closed-in spaces, fear of animals, and fear of blood. The fear associated with phobias is out of proportion to the actual danger posed by the object or situation and can interfere with a person's ability to function in their daily life. For example, someone with a fear of flying may avoid traveling by plane, even if it means missing important events or opportunities. What is agoraphobia? Agoraphobia is a specific type of phobia characterized by a fear of being in places or situations from which escape might be difficult or embarrassing, or in which help may not be available in the event of a panic attack or panic-like symptoms. Agoraphobia can be associated with panic disorder and is often accompanied by a fear of having a panic attack in a public place or an avoidance of situations like public transport, crowded places, or open spaces. Treatment for phobias typically involves a form of therapy called exposure therapy, which involves gradually exposing the person to the object or situation they fear, in a controlled and safe environment, to reduce their fear and anxiety over time. Medications such as antidepressants and anti-anxiety medications can also be used to help reduce the symptoms of phobias. Social anxiety disorder? Social anxiety disorder, SAD, is a mental health condition characterized by a persistent and excessive fear of social or performance situations. People with SAD may experience intense anxiety, self-consciousness, and embarrassment in situations such as public speaking, interacting with strangers, or being observed or judged by others. This can lead to avoidance of social situations and significant impairment in daily functioning. SAD is treatable with therapy, medication, or a combination of both. What is separation anxiety disorder? Separation anxiety disorder, SAD, is a mental health condition characterized by excessive and persistent fear or distress when faced with separation from a primary caregiver or attachment figure. It is most commonly diagnosed in children, but it can also occur in adults. Symptoms of SAD may include persistent and excessive fear or distress when faced with separation, persistent reluctance or refusal to go to school or work, nightmares about separation, Physical complaints such as stomachaches or headaches when faced with separation, and excessive worry about harm coming to the attachment figure or oneself during separation. SAD is treatable with therapy, medication, or a combination of both. How common are anxiety disorders? Anxiety disorders are one of the most common mental health conditions. According to the National Institute of Mental Health, NIMH, it is estimated that about 19.1% of U.S. adults, about 44 million people, have an anxiety disorder in any given year. Anxiety disorders are more common in women than men, and they often co-occur with other mental health conditions such as depression. The prevalence of anxiety disorder can vary by race, ethnicity, and socioeconomic status. The onset of anxiety disorder typically starts early in life, with the median age of onset being 11 years old. How do anxiety disorders affect children? Anxiety disorders can affect children in a variety of ways, and the symptoms may vary depending on the specific type of anxiety disorder and the child's developmental stage. In general, children with anxiety disorders may experience intense and excessive fear, worry, or distress in certain situations or across multiple areas of their life. They may also have physical symptoms such as stomachaches, headaches, or trouble sleeping. Children with anxiety disorders may have difficulty in school, as the symptoms can interfere with their ability to focus, pay attention, and learn. They may also have difficulty making friends, as the fear and avoidance associated with their anxiety can limit their ability to engage in social activities. They may also have difficulty separating from their parents or other caregivers, which can limit their independence and ability to participate in age-appropriate activities. It is important to note that children with anxiety disorders may not express their fears or worries directly, and their symptoms may be misinterpreted as shyness, disobedience, or oppositional behavior. Therefore, an accurate assessment and diagnosis by a mental health professional are crucial for proper treatment. What causes anxiety disorders? Anxiety disorders can be caused by a combination of factors, including genetic predisposition, brain chemistry, personality, and life events. Trauma, such as experiencing a traumatic event or growing up in a traumatic environment, can also contribute to the development of anxiety disorders. Additionally, certain medical conditions and medications can also cause symptoms of anxiety. What are the symptoms of an anxiety disorder? Symptoms of anxiety disorders can vary depending on the specific disorder, but they often include excessive and persistent feelings of worry, fear, or unease.